Hopping in Politicon right now, and we got lots of people jumping in. We got three officers here. Okay. Wow. I didn't know the free exchange of ideas was so threatening. Oh, look at him rock. Way to go. Okay. Wow.
So you weren't willing to put your life on the line.
Hey, justice. Wow, he's tricked out. True. You're running for president, buddy, or what?
Yes, sir.
Okay, great.
Yeah, absolutely.
And the party is what? Freedom?
Democrat.
You're a Democrat? Oh, okay. Sorry if I'm in your way.
Thank you.
You got a cool one on the front too.
Absolutely.
Yes, sir.
Okay.
I'm an author. I'm on Amazon.
Got it. All right. Well, will you wear that at the inauguration?
At the inauguration, that would be inappropriate, but I'm going to wear it throughout my campaign.
Okay.
Yeah.
So you'll wear a suit? All right.
I've designed a suit, actually. I've designed a totally different suit that nobody's ever seen before. Totally professional, totally tailored to mine.
So you're running as a Democrat?
Yes, sir.
Okay, so
I'm running as American. I just happen to have to sign up for a party.
Okay, you don't have to, actually. You could just run as a no party.
Yeah, but I'd like to win.
Okay, so you feel as a Democrat you'd win?
Absolutely.
Why?
Because I believe that between the two party systems, I align better with Democrats than I do with Republicans.
How are you going to win as a Democrat?
How am I going to win?
Because, I mean, the Democratic brand is in really bad shape right now.
Well, exactly. That means that the Democratic brand needs some leadership.
Okay.
Right now, there are two major factions of the Democratic brand. You've got the Bernie factor, and you've got the moderates more like me. Now, to me...
They're moderate? Really?
Well, I'm moderate.
Okay.
I said the moderates more like me.
So let me ask you this. Let's talk about some policy views.
Let me finish my statement.
Okay, go for it. Okay.
So my interest is to reach out to Republicans on the moderate side of the Republican side.
Okay.
I'm not going after the Bernie people. Bernie people can kiss my ass. And I'll say that.
Okay.
I'll say that for the record. Bernie people can kiss my ass.
So Harry Wiidifieldis says to the Bernie supporters, kiss my ass.
Absolutely.
Okay.
Real basic reason for that. If I move towards the left, I cede the center. If I cede the center, I give up the nation. The nation has to be united. If we don't unite this nation, we have way bigger problems than whether or not we have health care.
Why is the what are the sources of disunity?
Sources of disunity, I think, a lot of times are miscommunications. I'll give you a great example: healthcare. If you go ask 10 people, you can do this after we get done here. Go ask 10 people what the meaning of single payer is.
Yeah.
You might find 3 people who will tell you what the actual meaning of single payer is. We get to the mandate.
Do you support it?
I do support a single payer.
Okay.
And the reason I do is because the insurance company adds an extra layer of profit.
Sure, they got to make money.
Well, they
got to make. And I understand you have a different view on that.
Well, because
so
there's
a third party. Correct. There's a third party.
Right.
But the government becomes the third party, doesn't it?
Control the spigot. Here's the thing: the insurance company can deny claims, so they can control by turning a spigot, essentially control their own profit and loss.
Here's my response to that. Now, I'm a free marketeer, not just a Trump supporter.
Yes, sir.
Okay, now, if you're a single payer guy, but then you're not a free market because that is higher taxation and more government regulation.
Well, I'm not interested in a tax system for single payer.
But it has to come out of people that explain your single payer program. Let's go back to that.
I believe in a single payer program that runs sort of like the Federal Reserve is a institution to itself. It's not actually a government institution. Most people think it's government. It's quasi-government. So I would like to see a healthcare system, maybe even one for each state, but a healthcare system.
Every state makes up their mind?
Well, no. Basically, you get a federal mandate for the basics that have to be covered, and let the states figure out how it gets paid for thereafter. Some states might choose to go with a taxation program, but I prefer a premium program where everybody pays premium. Now, one thing we have to tell the truth about right now, we're given a grab bag when we're trying to sell a healthcare program. We're told that we're going to get all this. We're going to get lower premiums. We're going to get
you know what steps
conditions. We're going to get all these things. They're going to give you grab bag. You're everything you want and nothing you don't. Discounting the fact that over the next 15 years, 76 million people are going to be retiring and needing more health care. As people reach retirement age, they need more health care. So
I agree.
Health care's going up. We have to tell the truth about that. Well, so it's going to cost what it's going to cost.
Well, here's my response to that.
That's what the premiums are based on.
Okay, when you're talking about government operations taking over and dispersing the funding, because that's what single payer comes to, doesn't it?
Well, it doesn't. It can or it can't. It could be a quasi-government. It could be a private entity, just like the Federal Reserve is a private entity.
No, it's not. Oh my gosh,
no. The Federal Reserve is absolutely a private entity. Look it up online.
Okay, well, I'll follow up on that.
Look up on their website. Their website will tell you.
Oh, brother.
They are actually a private.
But they're paid with government dollars, correct?
Well, they regulate the government dollars, but
that's another problem, isn't it?
Well, it is.
See, this is where I have a problem of contention, or point of contention when it comes to the health care issue. People are saying, private firms will take tax dollars. Right, because that's the idea behind single payer. That's what I've heard from some people.
Well, the idea behind single payer is just this. Single payer means one person or one entity pays the doctors, hospitals, and clinics. That's all single payer means. One entity. We can decide what that entity is going to be. But
it's a government solution nonetheless.
Well, it can be a government solution.
That's what it is, because it becomes a set of laws.
It can be a government solution or it can be a contract solution.
Well, why can't we have different contractors who decide how they pay them out?
Well,
why don't we go the other way?
When we do that, those contractors have the ability to turn the spigot because they can deny your claims.
Now that's a serious issue.
Very serious.
So here's my response to that. We have contracts and we have courts for a reason to prosecute these abuses of power.
Yes,
now, what can we do to ensure that insurance companies do their job? I have car insurance. Car insurance companies don't rook in nearly a nasty way like you're suggesting because there's a lot of competition. You have an insurance company that develops a reputation of rooking its clients. Yeah. They're going to take their business elsewhere. We need more choice, more competition. We don't need a single, we need a multiple choice.
Let me ask you this.
It's on the other way.
But let me ask you this, even though with a multiple choice, the insurance company is still looking out for themselves. Who's looking out for me? As the patient, who's looking out for me?
They have to look out for you or they lose money.
Well,
yeah.
But they're also looking out for themselves.
Sure. Businesses do that all the time. Businesses want to make a profit.
But they have a split interest. See, they have a split interest. We've already got profit levels in the medical system. We've got the doctors and nurses. We've got the hospitals. We've got the clinics.
I'm going to have to disagree with that.
We've got the pharmaceutical companies.
Pharmaceutical is abusive, though.
We've got the medical supply companies. We've got the prosthetic companies. There are tons of places that profits. So why are we adding an extra layer? Because what happens is, let's say I give you money to give to this gentleman. Okay, so I give you money to give to this gentleman, and because I have a bill with this gentleman. Okay. But you say, no, you know what, I'm not going to give my money, that money to that gentleman, and I don't have to give it back to you, and he still can come to me legally. That's the system we have now. He can still come after me for the money I paid you to give him. That's how that works. That's how the system works right now. So if we don't find a solution for that, then all we've done is create a profit nozzle for the insurance company.
I want you to run me through that one more time. So you're the insurance company. I'm the patient. He's the doctor.
I'm
or
the
what?
patient.
Okay.
You're the insurance company, and this gentleman right here, he's the hospital.
Okay.
So I go to him. The law says he has to treat me. He has to provide the service.
Right.
That's what the law says.
Right.
Okay. So he has to do it regardless. All right. So he gives the service, and he wants his money. He goes to you because I say to him, hey, this guy's got your money. And you say, no, I'm going to deny that claim. So this guy's going to come right back to me. Legally, he can do that, and legally, you can do that, and I'm fucked.
Well, I have no problem with the government stepping in enforcing contract. That's not acceptable. Insurance companies must abide by the contracts they sign by.
Well, they abide by their contract.
No, they're not. Well, if they're denying claims when they're not supposed to do that.
Well, they deny claims all the time. And
I'm good.
To do so. They can come up with the smallest little reason to do so.
That's fraud, and they can't do that.
They do it all the time.
Well,
and we take them to court for it all
now
the
here's
time,
the
and
other
they lose
thing,
all the
and
time,
here's the
they
other thing
also win
too.
a lot. In the meantime,
People find
I
this
don't have the
offensive.
money. In the meantime, I don't have the money. If I'm a middle-class guy,
Yeah.
I'm working 70 hours a week driving a truck, I don't have time to stop my life so I can take this big insurance company to court
Yeah.
over the next 7 years because they got more money and they got more lawyers than I do.
So this is.
So
I want to
win
add.
because I don't have the resources to win.
What you're describing is corporate abuse.
Absolutely.
But my response to that is not a government intervention or a single-payer system. That's going to lead to more abuse and less accountability. NHS, Canada, they have different systems, but it's essentially a government-run system.
Well, actually,
They're
Canada has
poor
11 different systems. My children are Canadian.
Okay,
and
do they
they're on the-
like it?
They love it. They're on the beat, and I love it. I pay $435 a month Canadian for my 2 daughters and my ex-wife to have health insurance. My daughter breaks her arm. You know how much it costs her to go to the emergency? Not a freaking dime. You know how much it costs her for patient care afterwards?
No,
Not a freaking dime.
it
You know how
doesn't cost her, but there's rationing, there are lines, the average wait time is hours. Yes, there are.
No, let me tell you right now what the Canada system is. It's a triage system, and every hospital has a triage system. And what that says is if it's a life or limb-threatening issue, that takes precedence over an elective surgery.
Okay, but that issue of elective surgery is where there's lots of problems.
Well-
You have one lady, for example, who had a heart condition. She couldn't eat. She was starving to death. She had to go to the United States to get care because
And-
the bureaucracy called
And you
it
know who paid,
elective.
and you know who paid for it?
So she paid for it.
No, she didn't.
Yes, she did. I will get.
The,
I'm going to take this offline, everybody. Later, folks.